Well, this is AA4FL for the Medical Amateur Radio Council. This is our grand rounds on the AirNet. The Medical Amateur Radio Council has been in existence since 1966. We gather on Sundays at 11 o'clock in the morning Eastern Time to discuss health topics of interest to all amateurs and to the public in general. Again, we've been doing this for many years, not all the way back to 1966, but for many years, and we make this available quite often as recordings for the public as well for YouTube videos, which we're going to be doing today. This is National Children's Dental Health Month in February, so we've chosen an oral health topic. And I am a dentist myself. AA4FL is my home call. Today's net is taking place, the net control myself is in Hawthorne, Florida. But this is live on the air discussion and forum that's taking place is on obviously for hams, it's the public shortwave radio airwaves, and we are healthcare hams in the format of this discussion being a ham radio net open to all amateur radio operators. It's moderated by members of the Medical Amateur Radio Council, which is also known as MARCO. And today, as I mentioned, I'm the moderator for today's discussions. So the net traffic are not medical diagnosis or recommendations. Amateur radio is a vibrant hobby of individuals from all walks of life who often meet in nets and discuss items of passionate interest. We discuss health-related topics in our net. And since everybody should have an interest in their own health, MARCO members consist of those not only in retired from health careers or active in health careers, but from all backgrounds, all walks of life. And if you're interested in knowing more about MARCO, and if you would like to see the slides that I'm working off of, I'm actually using some visual cues here in my shack here in Hawthorne, Florida. I have published a link to those slides, and you can obtain that on healthcarehams.org. If you go to the website, healthcarehams.org, you'll be able to click on the link. It's under posts. On that link, you'll get the background information that I'm looking at. But in terms of the net, we're just having a discussion. This is not a lecture. Who is MARCO? What is MARCO? For those of you who aren't familiar, a group that promotes goodwill and fellowship among amateur radio operators worldwide who are professionals in the healing arts, who have an interest in the various medical, dental, and allied fields which constitute the healing arts. We do have two websites, the healthcarehams.org that I just mentioned. We also have one, marco-ltd.org, and you can just Google the Medical Amateur Radio Council and find your way to that particular domain. Now, at this time, I'm going to pause for any further check-ins that we might have. Make your call to Whiskey Bravo 5 Delta.
Whiskey 9 Foxtrot.
Okay, Jeff, Whiskey 9 Foxtrot from Chicagoland. Thanks for being here with us today, Jeff. Any other further check-ins, make your call.
Hey, Jerry, this is K4AAC Atlanta.
K4AAC, I believe you're in the Outer Banks today, is that correct?
That's correct, with my better half out here doing radio.
Well, enjoy your time and doing radio here in the Outer Banks today. I know you participate in Parks on the Air, which is a very vibrant part of our hobby, where individuals go into different state and national parks and activate them or make them radioactive. And there are awards and recognitions for speaking to as many parks as possible. And some people are very passionate about that part of the hobby. Thank you for being here, Alana. Any other check-ins? Make your call to Whiskey Bravo 5 Delta. Okay, no further check-ins at this time. Once again, the general public, the amateur radio operators that are listening on the public airwaves here on 14,342 megahertz, please do check in if you'd like to participate in the discussions. This is a net, it's an interactive forum. But oral health linkage to systemic disease in itself is bidirectional. It's a bidirectional issue because poor oral health affects your overall health, your systemic health, and poor systemic health affects oral health. And today, of course, we're doing this in honor of National Children's Dental Health Month. So you'd say, well, why would they have these kind of problems as children? Unless you have some congenital defect, you probably wouldn't at this age, but you have to set the stage for good oral health at a young age. And that's one of the reasons that we're discussing this today. We want you to realize that oral health is just part of overall health. They're connected. It doesn't exist in a vacuum. And we're going to talk a little bit about that connection today as well, and what some of our members have seen in practice. And going back when we talked about congenital defects, there are times, and it's not directly related to systemic overall general well-being health, but there are people that have issues, congenital issues with their heart valves. And they can be very susceptible to issues in the dental chair, because in the dental chair, we're dealing with a lot of bacteria. When you have your teeth cleaned, especially if you have quite a bit of disease, it will peak in the bloodstream. And being that the blood flow around those heart valves is not normal, if bacteria would settle in on some of the damaged tissues from that inadequate blood flow, you can get an infection of the heart valve that's very difficult to get rid of. Why is it difficult to get rid of? Well, once it starts to get infected and you're taking an oral antibiotic, if you don't have proper blood flow to that area, how are you going to overcome the infection? So it can be very serious. So that's just one example of an effect from having an improperly health mouth, and how that bacteria can contribute to other diseases. We're going to be looking more at overall systemic diseases, your overall health, things like heart health, brain health, and whether or not there's actually connections to the two. So we said bidirectional. We say bidirectional, we're discussing the effect from other diseases as well that can be seen in the mouth. And that's not necessarily in the core topic that we're discussing today. Do we have any providers here today? I know a number of our members were in emergency medicine that might like to talk about that. Andy, WJAB, if you're here, were there ever times when you saw signs in the mouth that actually emanated from another area of the body? Go ahead, Andy. Okay, I'm not hearing Andy right now.
Okay, now I think I found it.
Okay.
So,
go ahead, Andy. WJ.
okay. Yeah, probably the one that stood out that I mentioned this morning on the digital net is multiple myeloma. Multiple myeloma leads deposits of amyloid in various parts in the body, and it can be in the heart and the kidneys, but it's also occasionally in the mouth. And we have seen a couple cases of that during my long internal medicine career, both training and active practice. So there's not a lot, just a few. Multiple myeloma is a disorder of the bone marrow where the cells that produce antibodies get a clone of an antibody and produces them way more than they're supposed to. And in that case, particularly if it's an IgA monoclonal antibody, can cause these deposits to occur in multiple locations in the body. And in some cases, it is diagnosed from a dentist or an oral pathologist who sees that and then actually allows the regular medical professions to pursue the rest of the way down. So back to you, Jay, from WJB.
Okay, thank you, Andy. WJAB AA4FL. In mentioning that, Andy actually helped out at a clinic for the poor and underserved a few weeks ago. And one of the dental students who I was covering was consumed with the thought of somebody came in for having teeth extracted for dentures. And she happened to call me over to take a look. I asked to see the panoramic x-ray, and there were lesions all over the jaw. Very irregular lesions, and that's exactly what I suspected, multiple myeloma. And I explained to her that we needed to get the patient evaluated as such before we would do extractions. The lesions were actually so large that if they had tried to take out some of those teeth, it's possible that the jaw would have been fractured. And that's just what we're seeing in the jaw. We can imagine when they have a full body scan, we're seeing lesions all over. So oral health is related to systemic health. Often there's other disorders I can think of, Andy, like pemphigus, skin disorders, where you'll see that where it expresses itself on other parts of the body, but also in the mouth. Jack and KD4IZ, can you think of any other diseases that systemic diseases where you've seen oral signs in the mouth, especially being a periodontist such as yourself, Jack? Go ahead, KD4IZ.
Yeah, certainly. Jay, you hear me okay over on Zoom?
Everything's good.
Very good. Okay, yes, and it's something, let's start back at the beginning of things. Very frequently, I have run into children who have not shed all of their deciduous teeth, and for social reasons, I guess is a good way to put it, parents have neglected to have caries treated. The individuals wind up with very severe infections, some of which actually dissect it down along the windpipe and into the area around the lungs. It's a life-threatening situation, and these children need to have a lot of support. We have actually a law here in Maryland that is named after a child that passed away after dental neglect. The issue is really one of those, I wouldn't call it rare, but it's something that is seen, and it's seen early in life. Since this is Children's Health Month, I thought I'd bring that up. And you're going to go into the systemic health picture here, particularly there are some immune disorders that do not create a whole lot of problems for people, but they're enough to allow certain types of disease to develop in the mouth rather rapidly. And we'll probably talk about those later, Jay, but I think those are things that people need to be acutely aware of, particularly for kids. And it's a good reason, to have your children used to going to the dentist, getting dental care, at least at the hygiene level, if not more, right as soon as they have teeth.
Well, thank you, Jack. KD4IZ. This is Whiskey Bravo 5 Delta, the Medical Amateur Radio Council, AA4FL, the Mike, a regular scheduled net every week, operating today out of Hawthorne, Florida. Again, home call AA4FL. Jack, it's timely that you mentioned that, because actually this same last session where I saw the patient suspected of multiple myeloma, one of the other faculty members had the situation arise in the previous month that you're talking about. The patient had aspirated a piece of calculus, which is tartar, which is the buildup quite commonly behind the lower front teeth, and they weren't treated. They inhaled it, and they got into a serious life-threatening infection. But let's think about this in even gentler, kinder, everyday terms. For those of you that have children and grandchildren of that age, often we talk about senior citizens, and when we can't hear, how we have a general loss of health and welfare because they seem to shut down. Well, think about children that have dental disease and pain. They often will avoid school because of the pain, or they'll underperform, and they'll get insecurities, and their general health and welfare also deteriorates. And I'm sure the same effect in self-confidence from having a smile or having constant problems that other children do not have. So let's not diminish those more everyday situations. We're talking about the infective endocarditis and talking about the source of bacteria from the mouth going to heart valves. Just talking in basic terms, and think about friends that you have. If you've seen somebody smile where they have big red swollen gums, or they have black areas of decay on their teeth, and they have problems that you can't see that a dentist can see. They may have big holes in their bone associated with some of those infections from the big cavities. And all those take a toll on the body as well. And they can also lead to bacteria causing issues by spreading through the bloodstream. Well, those are called odontogenic infections or periodontal infections in the case of the gums or the support for the teeth. Think about the body this way and think about the teeth. What part of your body is live, has blood running through it, but essentially is outside of your body? I mean, teeth have multiple layers on the inside, they're blood vessels, then they have some protection. And on the outside, they're so hard, they're almost like fingernail hard. And yet, we have to keep them healthy. And everyone should be aware of how to do that. It's not that difficult. Now, you would think everybody has control over their own destiny, and that's true. But there are people that have genetic defects, and it's more difficult for some people than it is for others. But the point is to start off when you're young and have your grandchildren and your children taken care of and making sure they get off on the right start for good oral health. Now, we're going to talk a lot about comorbidities. Comorbidities are other diseases that go along with the gum disease. And it's hard to sort out when you're talking about the effect on the heart from the gums and the bacteria that are around these infected gum tissues, or coming from a big cavity or a hole in the tooth. And it's hard to separate that and to prove that there's a direct connection. Now, there are studies that look at it, but if you think about all the other issues that one can have, you can have diabetes. There's other you just have poor overall health. What if you're an alcohol drinker? I mean, to the point of abuse, or you're a smoker to the point of abuse. And these have an effect on the body in general, not just the teeth. I'm going to pause one and identify. This is Whiskey Bravo 5 Delta, the Medical Amateur Radio Council Grand Rounds of the Internet, Obadol amateurs. And we encourage you to check in. I'm going to pause now for additional check-ins so that you can take part, all amateur radio operators, in this on-the-air discussion. Do we have any other check-ins? Make your call at this time. Okay, I don't hear any further check-ins right now. So going back to this thought about gum disease and heart disease, you can read about it online. If you Google gum disease and heart disease, commonality or common thread. The Harvard Health Publishing has an article how plaque may on your teeth may be connected to plaque in your arteries. And just to give you an idea of some of the quotations from that particular article, for decades, researchers have probed the link between gum disease and cardiovascular or heart health. Gum disease begins when sticky bacteria-laden film referred to plaque builds up around the teeth. A completely different type of plaque made of fat, cholesterol, calcium, and other substances found in blood can build up inside arteries, known as arteriosclerosis. This fatty plaque is a hallmark of coronary artery disease. So you can see from that quotation the possible connection and why we would be concerned. If you get plaque around the teeth and you have inflammation or swelling in those local blood vessels from that plaque, and then the same thing happens inside a damaged artery, is that arteriosclerosis, or hardening of the areas, become an even bigger problem. So people with gum disease, also known as periodontal disease, have, going back to quotations, 2 to 3 times the risk of having a heart attack, stroke, or other serious heart event, a cardiovascular event. There may not be a direct connection. It's very hard because many people with heart disease have healthy gums, and not everyone with gum disease develops heart problems. But there are other shared factors, such as smoking, an unhealthy diet, and that can still explain that association. But there's a growing suspicion that gum disease may be an independent risk factor for heart disease. So the question is, are there studies out there that prove it as of this time, even though it's suspected? The link, as I mentioned before, is inflammation or swelling. Periodontal disease or gum disease increases the body's burden of swelling or inflammation. And because of that, acute inflammation involves an outpouring of immune cells that attack the irritants and microbial invaders, fosters healing over the short term. But if it becomes long-term or chronic swelling, it can be a key contributor to many problems, especially arteriosclerosis. But to date, there's no proof of treating gum disease will prevent heart disease and its complication, but the connection is compelling enough that dentists and many doctors say it's another reason to be vigilant about preventing gum disease in the first place. So if you would Google Harvard, gum disease and heart disease, the common thread, you can read all about that particular article. There are plenty of research that's been done now to see if there's proof for that. And that's ongoing research. There's current articles I can cite from 2024, 2021. It's ongoing evaluation. And I'm going to introduce just a few abstract thoughts from those particular articles So as ham radio operators and the general public, you know where the concerns are, and you know where you can focus your efforts on to minimize the chances of yourself getting advanced disease, or also support your family where you see the potential existing, and explain some of these resources that we can find online. Do we have any other further check-ins at this time? Make your call to Whiskey Bravo 5 Delta before I continue on. Okay, and Jack is with us, KD4IZ, and Jack being a researcher and a periodontist, as we start to talk about some of these articles, I'm going to also ask for Jack's input. And we also have a neurologist with us, M3PQ, up in Pennsylvania, and we're going to have Munir talk a little bit later about possible cognitive issues with the brain. So if you're listening, you're a ham radio operator, and you feel that this is going to be interesting, please do stop by and participate. Again, this is open net. Don't have to be a member of Marco to participate in the net. So there's a particular article in the American Heart Journal plus Cardiology Research and Practice for 2024. And if you Google this, the article is called More Than Just Teeth: How Oral Health Can Affect Heart. And a lot of these articles, some are abstract, but some you also can read the full article. And I believe this is one that has an Adobe Acrobat or a PDF file of the entire article. You might find it interesting. And what they say is epidemiological evidence has revealed, the study research, that the potential relationship exists between periodontal disease and cardiovascular disease. The consensus, however, is elusive, and largely secondarily, it's elusive because of considerable overlap between risk factors, as they mentioned, comorbidities or other diseases that are common to both disease processes. The article, as stated, that I suggest that you Google and look up, aim to update the evidence for association by summarizing the evidence for causality between gum disease and comorbidities linked to cardiovascular disease. Now, some of the ones they mentioned that they were looking at is endocarditis, which we previously talked about, that heart valve infection, hypertension or high blood pressure. Those of you that are familiar with atrial fibrillation, some of you may have family members, it's very common, coronary artery disease, diabetes, and hyperlipidemia. And they looked at all these areas and discussed the roles for periodontal therapy to improve management of those particular diseases, with a larger goal of examining the value of gum disease therapy on reducing cardiovascular risk or heart disease risks. So that's the extent of that article, the purpose. I suggest that you look that one up, and in just a moment, we'll state their conclusions. But I'm going to give Jack, KD4IZ, a moment to offer his input on that particular topic from his perspective. Go ahead, Jack, KD4IZ, Whiskey Bravo 5 Delta.
Okay, Jay, very, very simplified way of looking at this. And I think you cover this on a slide a little later on in a graphic. But I think the most important thing to put in your mind when you're talking about comorbidities and using some of the medical technical jargon is you have to think about what happens over a lifetime. Your body is continually fighting off insults. Those insults cause changes in your immune system, your physical health, all at the same time. And it's a slow process most of the time. What happens over an extended period of time is that hammering away at your defenses leads to changes in the way you respond, many of which are not necessarily in your best interest. Hence the cardiovascular issues, neurologic issues, and all that are associated with some of these diseases. If you happen to be unlucky enough to have juvenile or an early form of diabetes, your susceptibility is going to be greater to some of these problems. If you have other, for instance, soft tissue diseases, connective tissue diseases, your susceptibility is different. It's not as good. And so all of those things kind of wrapped into a ball, if you will, set you up for degenerative changes, I guess is the best way to put it, that allow these disease processes that we see in the heart, see in the brain, see in other parts of the body, the bones and the joints, to get started and to continue. And as far as we know, the only way to reverse this is to back up against those problems. So oral health, GI health, gastrointestinal health, things we do to our skin, exposures to various nutrients and toxins that we ingest with our foods, all can have these effects. And if you can back away from those insults, you can regain a little bit of the health that you started with. Unfortunately, over a long period of time, that's difficult to go back against. Really, what I have to say there is important. Many of these articles are looking at it from one direction or another, some of them from all of those directions, but they guide us to the same point, that it is a total picture. I think that's what I got to say, Jay.
Okay, thank you. KD4IZ, Whiskey Bravo 5 Delta AA4FL, the mic, and the conclusion of this particular research article. And again, you can Google it. It's more than just teeth. How oral health can affect the heart. From the American Heart Journal Plus, Cardiology Research and Practice, is that the available data strongly suggests that periodontitis, which is gum disease, periodontitis, may have overall health consequences, just as Jack mentioned, specifically pertaining to cardiovascular disease and associated diagnosis. And there's significant evidence exists that gum therapy, periodontal therapy, may contribute to improved outcomes in these pathologies, due largely to the decreased inflammation or the swelling within the body, overall the entire body, not just the tissues around the gums. But there's more studies warranted to confirm the findings and to further guide clinical practice for the management of gum disease in regard to the risk of cardiovascular disease. There's a high prevalence of gum disease in populations here, very high. And the disease is fully preventable with proper oral hygiene practices. So we need to emphasize that starting young and living a healthy lifestyle. Now, Jack had just mentioned that, it's a continual assault on the body over time. And over time, it has a cumulative action. For those of you that are not in the health professions, but more in the bioengineering or just engineering, think of fault tolerances. How many times do something have to fail before it has an effect? There's a built-in backup tolerance in every particular electronic component. But at what point does it overwhelm that component where the whole system goes down? So you can see the correlation between a biological environment and electronic environment. So I hope that helps to explain for some of those in the amateur radio community that are listening today, and for the public as well. Are there any other input from our members here on 20 meters? I'm going to pause for a moment and take a list for anybody else that would like to offer some input. Make your call at this time to WB5D. Any further input on the Zoom side? Anybody like to make comments at this point? Okay, by the way, sometimes we monitor comments. I'm multitasking here today. If anybody's writing me comments electronically, I'm focused totally on our listening audience right now. Another article that I found that was interesting, and just looking through the literature, was the oral health inextricable connection to systemic health. Special populations bring to bear multimodal relationships and factors connecting systemic disease and conditions in the same points here. And you can Google that and find that as well. That particular articles from Periodontology 2000. The landscape in dentistry is changing as emerging studies continue to reveal that periodontal or gum health impacts overall health and vice versa. And the studies on animal studies underscore the importance of oral health to overall health. And these are inextricable relationships come to the forefront as oral diseases such as periodontal disease take root, which is what Jack was mentioning. You know, we start, and then we get this acute or an immediate load the body has to respond to, and the body might be able to put up a good front. But over time, how much can you fight the same problems? And then if you throw another factor in, such as smoking or alcohol or improper diet, that further complicates the body's ability to manage the affront to its health. And special populations bear that multi-model relationship, specifically periodontal disease. It has been associated with diabetes, metabolic syndrome, obesity, eating disorders, liver disease, cardiovascular disease, Alzheimer's disease, which we're going to talk about a little bit later, and why that might be, rheumatoid arthritis, adverse pregnancy outcomes, and cancer. So although the bidirectional relationships are recognized, the potential for multiple comorbidities or relationships and connections also exists. So the proposed mechanisms that mediate this connection are predisposing and precipitating factors, which include genetics. Well, we can't control our genetics, and we have to realize that. But there's also environmental factors such as stress, habits, smoking, high-fat diet consumption, highly processed food, medications that we're on. A lot of seniors are polypharmacy. They're taking many, many different prescriptions. And just all altered host responses where you can't handle bacteria and viruses very well. So realize it's very complicated. This is not medical diagnosis here. This is discussion today. So that you'll just be aware that you know, the situation is continued to be studied, but there's a lot that you can't control. You can certainly control what you put in your body and what you do to your body. You can't control the genetics, but you can decrease your risks. Now, we talk about risks in life. You hear that quite often. I mean, if people continue to smoke, they have a high risk for cancer. Doesn't mean they're going to get cancer. It's a matter of risk benefit. If you feel that smoking is a benefit to you personally, and you don't want to quit and willing to take the risks in all other ways, that's your particular choice. Okay? So thus, you know, in a susceptible host, you can certainly have problems, and they've been looking in that particular article in more detail of what viruses that might be present that cause inflammation, trying to find what makes people susceptible to viruses. And we look at systemic inflammation, and if you had to make a chart of systemic inflammation, you'd be looking at disturbances of the immune system. You'd be looking at what causes bacteremia or bacteria in the bloodstream, and then you would see from what sources that inflammation would spread to other parts of the body. So it's not just the mouth, it's overall, but the commonality is that periodontal disease, and we mentioned before, the teeth are complicated because they're in your body, but yet they're also outside your body. And what is the interface between the two? Your teeth are rooted in your bone through periodontal support. You've got fibers, gum tissues, connections to bone. When that is disturbed, you don't have a healthy environment, and you have the potential for disease portal to enter through that faulty interface of your mouth where you see bleeding and irritated gums and spread to other parts of your body. Jack, would you KD4ize that? This is Whiskey Bravo 5 Delta. The way I described that, is there another angle that you would find helpful in presenting that?
No, I think that's a good one. And this is exactly the diagram I was referring to. It makes you stop and think. It's what we face through our lives to one degree or another, stronger or weaker influences from some of these things. But there is a common theme, and I think you've pointed that out very well.
And we're referring to some diagrams. If you would go to healthcarehams.org, our website, healthcarehams.org, those of you here in 20 meters, and you would go to the posts. I posted a link to the prompt slides that I'm using today, the ones I'm using to stimulate the discussion, to seed the discussion. I mean, my memory is reasonably good. I try to eat as healthy as possible, and I certainly don't have periodontal disease. So I haven't had the cognitive or brain effects yet. I'm staying pretty sharp, but even in spite of that, I've got to have prompts. I'm sorry, guys. So I apologize if I have slides that I'm working off of, and I know on 20 meters, the general amateur community can't see those directly because we're on radio airwaves. However, I've made them available for your use. Please feel free to use them. Again, healthcarehams.org, and look for the link. So another article from a journal of biological medicine is nutrition as a mediator in the relationship between oral and systemic disease, associations between specific measures of adult health and nutrition outcomes. So if we look at that disease and we look at all the different studies they've looked at, just realize the diet is a potential problem for many aspects of health. And the teeth are no different. You'd hate to have your teeth taken out and have implants put in. You probably don't want that cost either. But when you need to have them done, it's an option that we're moving further along towards helping you with. But nutrition is extremely important. And if you want to look up that article or check out those slides I've made available for link, please do so. There's systemic diseases and oral health, another article that I found. And that article is a little older, from 2014, so this isn't all new. And as we get into the US population, we're beginning a significant demographic shift. The American geriatric older population is burgeoning. And this was 2014 when it was recognized. Longevity is projected to increase in coming years. Of course, this is pre-COVID, and obviously that slowed down this trend somewhat. But elder adults are affected by numerous chronic conditions, such as diabetes, hypertension, osteoarthritis, osteoporosis, cardiovascular disease, cerebrovascular diseases. And older adults need special dental care and improved understanding of a complex interaction of oral disease and systemic chronic disease that can complicate their treatment. Oral diseases have a strong association with systemic diseases. Poor oral health can worsen the impact of scientific disease. I'm going to pause one moment here to identify. Medical Amateur Radio Council Grand Rounds in the Air. We meet every Sunday at this time, this particular time of the year. 1600 is 11 a.m. Eastern. That's the time that we meet. Why do we meet on Sunday mornings? It's not as an affront to those that go to church. The reason why, medical doctors, when they were doing their hospital rounds, were very, very busy from Monday through Saturday. Sunday was the one day where they could gather on the radio to discuss health-related topics. And that's a tradition that's carried on to this day. So we're looking at bacteria going to the heart, and we're looking at the senior population. So what happens when we get older? People that are living in their 80s and 90s now, maybe they're independent living, but maybe they're not. And maybe they're moving on to the next levels of care. And what do they have for access for care? Do we ignore the fact that their gum disease may contribute to a decline in their overall oral health? I mean, quite often, seniors take a significant downturn when they get things as simple as urinary tract infections, and they get bacteria in their bloodstream. Those with a greater age can be much more susceptible to small changes because their body is sensitized to that affront. They just don't have the capacity that they did. And plus, if you're a senior and you're limited in your movement for whatever reason, then you're also not getting proper exercise, you're not getting proper blood flow, proper stimulation. So if you are a senior that's a ham radio operator that sits in your chair all day long working DX, try to get up and get some exercise, please. It's important for your overall health. Now, you can do CW all day long. CW is great for your mental health. You'll get the synapses working, your connections in the brain will be enhanced. So go for the CW and give up the FT8 every now and then. But do get out of your chair and exercise as well to get that blood flow going. I'm going to break here for any questions that one may have from 20 meters here. Please go ahead. This is Whiskey Bravo 5 Delta. I'll make your call.
I have a question, Jay, if there's nothing from 20 meters.
Okay, I think somebody has a question on Zoom. Would you like to go ahead and ask?
Yeah, my question is, we've seen all these correlations with various systemic diseases. How about depression? Any known correlation with depression? Not as depression causing poor oral hygiene, but the other way around.
Oh, that was N3PQ Manir asking the question as to whether or not we were aware of research that when somebody's depressed, can it lead to decrease in overall health, decrease in oral health from depression?
No, depression from poor oral hygiene, the other way around, like some physiological mechanism with poor oral hygiene contributing to worsening depression. This is N3PQ.
Yeah, I don't know the studies. I mean, from a common sense standpoint, and we have a psychiatrist with us. He might talk about it from a mental health standpoint, that if one has poor oral hygiene or medical or dental problems, how it may affect your psyche or your ability for health and welfare, and would that lead to overall decline? I'm putting you on the spot, N5-RTF. I know you're here with us. Just general wisdom, not scientific studies. What would you think that might be? If you go ahead and take the mic, please.
This is N5-RTF. Yeah, I don't know if there's a direct connection, but what happens a lot of times when people get depressed is they develop poor self-care, which generally means they stop eating properly, they stop exercising, they stop brushing their teeth, they stop doing lots of stuff to just keep their body up. And they can end up in what we call a nutritional death spiral, in which they just go down, 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 past the point of no return. The only direct connection that we run into frequently between psychiatry and dental health is a lot of our medications are anticholinergic. So anytime you see people on things like Cogentin and Benadryl, most of the antipsychotics, a lot of the antidepressants, all of those are anticholinergic, and they decrease the amount of saliva, which saliva helps to protect against dental disease. And when you remove that, then people on these drugs tend to have an increase in dental caries and infections. And we see that all the time, and have to warn patients in advance to keep their mouth moist. Does that help?
Yes.
Yes, thank you very much. Yeah, Manir says yes as well. N5-RTF, Whiskey Bravo 5 Delta. You know, I'm glad you brought that up, Manir, and also Chip, N5-RTF and N3PQ, because that's something that we commonly see in dental practice. Also try to teach that to dental students, and it happens every week in terms of treatment planning and making decisions. We had someone last week that was in their late 70s. I think they were 79, and they had some fast moving decay. And the question was how significant treatment do you do? What's the best choice? What's going to give you the best outcome? And when you have somebody that has a decreased salivary flow, yes, the decay rate is much higher, and all the buffering and other protectives that go on through the immune system through the saliva are missing. And if we think about dogs licking their wounds, there's a reason why they lick their wounds. Now, saliva is magic. I can tell you through years of doing dental surgery, it's very rare that I did not have a fast-moving healing process in the mouth, even with quite a bit of trauma and getting teeth out or whatever other procedure we're doing, bone removal and such. Saliva is a magic substance. It's part of the components to the immune system here. There are studies that look at the actual parts of the immune system and try to figure out if you can identify markers or that might indicate that you're having inflammation that originated in the mouth. And if you go to those slides, you can see some of the references to those studies. There's one in particular from Frontiers in Immunology that looks at systemic inflammation and the role of the macrophage. So I'm not going to go into those scientific studies, but just realize inflammation is a complex reaction injurious agents. It includes a vascular or blood vessel response, migration, and activation of certain parts of the immune system. And it starts with an acute reaction, as Jack had mentioned before, but that evolves into a chronic phase and allows to persist unresolved. In acute inflammation, that rapid process is characterized by fluid exudation or emigration of the fluid in those cells, whereas chronic inflammation extends over a longer time is associated with different parts of the immune system and the blood vessel proliferation. So you might want to read that study and look at some of the abstract and conclusions. If you're a healthcare care provider, of course, you can read it in more detail. But if you would just go ahead and download the slides that I've made available through healthcarehams.org, you can have a direct link. You can just click on the link for the PDF file and you'll find your way there. So that's just part of the area of research. That's not the only marker they look for. I mean, they look for markers. Also, we'll talk about some cognitive processes and markers that might be involved in cognitive changes. But the oral cavity is extremely complex. It's a microenvironment where the body interacts between the host and the microbes that are defining health and disease, the germs that are present around our teeth. And as we mentioned before, teeth are the only functional hard tissues extending from inside to outside the human body, crossing a series of other hard tissues such as bone and soft tissues, which is connective tissue and epithelia, the skin tissues surrounded by a tight biofilm or collection of bacteria formed by the richest collection of bacteria outside of the gut, outside of the colon. I hate to make a comparison between the colon and the mouth. This particular article does. You're not getting a potty mouth from me here, but typically there are two common diseases affecting oral tissues of the health supporting structure of the teeth. Gingivitis, it's limited to the soft tissues, to the skin and the connective tissue. It hasn't gone into the bone. And I'd say 90% of Americans probably have some level of gingivitis, some level of inflammation. But the problem is when it extends into the underlying supporting tissues that support the teeth into the bone. And in both forms of this periodontal inflammation, there's pathological or disease consequences associated with the accumulation of bacteria at the tooth surface, leading to the host response generating swelling or cell inflammation. So if you're leaving tartar on your teeth, you're not going to the dentist, you're letting it accumulating, you're not brushing and flossing every day or using some other health aid. And I mean, you hear ads on television all the time that say these rinses are more effective than floss, but you mechanically need to get that debris off of your teeth. Once it gets hard, and if you wonder why tartar comes in where it does, think about where you get your tartar. You're getting your tartar buildup behind your lower front teeth, and you're getting it on the cheek side of your upper back teeth. Why? Well, that's where your saliva flows in your mouth. So if you leave a soft accumulation of plaque on your teeth, you don't remove it with a toothbrush, what's going to happen? You're going to have components of your saliva that precipitate and make something hard. We all have had, even if you don't know what tartar is yourself, you've seen it on your pets. You've seen what their gums look like on your pets. You have the same potential for that. And once that tartar is there and it's inflaming that interface between what's outside of your body and inside your body, you're going to be getting swelling. And does that swelling cascade go into the bloodstream and into the heart vessels? Well, that's the question that we're talking about today. So once again, if you wanted to read that in more detail, just go to healthcare.hams and healthcarehams.org. I think I need some water for the parched lips from talking too much. As a ham radio operator, I have to do a lot of CW and FT8 because I don't know when to give up the microphone. That being said, do we have any late check-ins here today? Let's pause. Whiskey Bravo 5 Delta looking for late check-ins, IDing as well. Make your call.
And for JEL.
Kilo Charlie 3 Quebec Yankee Echo, is that correct?
Oh, that's correct. This fund manager is running the session.
Okay, well, thank you very much. And I hope you're finding this to be useful for the general population as well, if you're not a healthcare professional. Of course, we feel that it's important. This all originated, I don't know when you picked up the net here today. This is National Children's Dental Health Month, and we're stressing getting children off to a very good start so they develop lifelong good habits, because these are some of the serious consequences that can occur. Was there somebody else that would like to ask a question or make some input from 20 meters? Go ahead and make your call. Yeah, I've also checked in N4JEL. Mike is with us as well here today. Thank you for joining us, Mike. This is AA4FL at the mic for Whiskey Bravo 5 Delta, Medical Amateur Radio Council, Grand Rounds there. We're going to run a few minutes over our usual time. We usually finish at the top of the hour. And there was another article in the American Heart Journal Plus, Cardiology Research and Practice, of more than just teeth, how oral health can affect the heart. And I think you would find that very, very interesting, because that's the relationship between the two that we're talking about. We're talking about the gum disease, the bacterial induced chronic inflammatory disease that destroys the tissue and support the bone that's around the teeth. And it says that mostly half of adults have mild to moderate forms of periodontitis. Now, remember, I said gingivitis or bleeding gums could be up to 90%. But 50%, that's quite a lot of people, is it not? So knowing that that inflammation could extend into the heart vessels, then that's very important for all this research to take place, because of all the other diseases. And you throw other diseases that you might have that make you more susceptible. I mean, what if you're diabetic? What if you have hypertension? What if your cholesterol is too high? Does that mean that you're going to be more susceptible to that disease process? So, you know, the studies support the link, but it's still an elusive link that requires more study. And we hope that you all will be cognitive of that and associate with the need to maintain your oral health. What about gum disease and decline, cognitive decline in older adults? I mean, there are articles out there that discuss it. We had mentioned earlier people with hearing loss that are adults. They seem to suffer because of the social inability to hear. Do people avoid interacting with other people because of their oral health? Are they self-conscious because they're missing teeth? Because they're in pain? Will that lead to a decline in cognitive function? And if you would, how would you quantify that or qualify that? And how would you know what to look for? So I'm going to turn. We have a neurologist here with us, Munir. And Munir, would you like to offer some input to the general subject? N3PQ, Whiskey Bravo 5 Delta. Again, I give you the microphone.
Sure, Jay. This is N3PQ. So I came across this study in January 2025. It's from the UK. So very brief background. We know that in cognitive decline in older people, there's a problem with the apolipoprotein E4, APOE4. People who have that genotype are more predisposed to Alzheimer's disease. Also, importantly, nitric oxide deficiency is significant. These are risk factors really specifically for age-associated cognitive decline. So this study, they took about 60 healthy controls, I think, and 60 people with mild cognitive impairment. In the mild cognitive impairment group, I'm going to call them MCI from now on, there was a relative abundance of Neisseria, of the bacteria Neisseria. Whenever there was a relative abundance, they had better indices of cognition. Even the people who had mild impairment, they had better executive function and visual attention if they had abundance of Neisseria. In the healthy group, in the healthy group, an abundance of Neisseria was associated with better working memory, specifically digit span. High abundance of Haemophilus and Haemophilus parainfluenzae seem to co-occur with the Neisseria. Those people had better scores on executive function, the prefrontal lobe. On the other hand, people who had Porphyromonas, that was a predictor of mild cognitive impairment, and people who have Prevotella, this is the first time in my life I hear this bacteria, Prevotella intermedia, that was a predictor of ApoE4 carrier status. So again, higher risk of people with MCI developing Alzheimer's. Now, why would this be the case? There are some mechanisms that people theorize about, and again, important to emphasize, we don't know that this is a cause-effect relationship. We know it's a correlation. So what causes what? Is it just association? We don't know. Possible mechanisms, the direct route, trauma to the mouth, where oral bacteria can gain access to the circulation and then to the brain through an increasingly permeable blood-brain barrier, can increase inflammation in the brain. There's an indirect effect where impairing the oral mucosal barrier of allowing metabolites, which allows metabolites produced in the mouth to enter circulation, can also increase inflammation through overproduction of cytokines. The other potential mechanism is nitrous oxide. So the production of, nitric oxide. The production of nitric oxide can happen through the nitrate, typically happens to the nitrate, nitrite, nitric oxide pathway. So NO, nitric oxide, is an important signaling molecule affecting multiple processes in the body: vasodilatation, muscle contraction, neurotransmission, a host defense against microorganisms, and it has a role in synaptic plasticity and long-term potentiation. So when there's an imbalance in bacteria in the mouth, it seems this imbalance can impact the formation of nitric oxide from the nitrate found in diet. So the question is, what can we do to restore this balance? And because it seems to be significantly important. We've always known, or we've known for a long time, that gum disease is associated with dementia, but this is a more specific elaboration of how they can be associated, what's happening there. So I don't know, you can tell me, is there a way to increase the Neisseria and decrease the other bacteria in the mouth? I'm not sure about that. Yeah, this is N3PQ.
Okay, thank you. You know, I very much appreciate Munir N3PQ, this Whiskey Bravo 5 Delta, you submitting this article, because a neurologist who is constantly reviewing the literature, this is a study that was just released in January of this year. I think it just goes to show how complicated the situation is and how much research is being done because of the importance of the subject matter. But going back to our general basic discussion today for all the amateur radio operators that are here listening, the public that's watching our YouTube video, there's no hiding from overall general health. And you have to have healthy habits to have general health. There's consequences. And the question as we get older, what's that accumulated stressors that put on our body, the stresses that occur over time with chronic conditions. Do everything you can with your children or your grandchildren to get them off to good, healthy habits, not just their oral health, but also their diets. And if you have seniors in your family, do everything you can to keep them mentally healthy and stress-free. And we know that if you get Alzheimer's, there's different stages. The changes occur over time. If you see some early stages and you suspect there's an issue, make sure you consult a neurologist or geriatric doc there to have it properly monitored. Unfortunately, it's a very common disease process, and I know we've had that afflicted in our family, and it runs in my particular family. And unfortunately, I've had personal experience with family members with that path leading to fatality, unfortunately. Now, we live long lives these days. So if we go back 100 years ago, you know, I think Chip and I, N5RTF, in many of our nets in the past, we've talked about various subjects as ham radio operators, not just medical subjects. We've talked about wars, we've talked about culture. And, you know, when we go back to ancient times, the longevity wasn't there like it is now. People are living long lives. If you have a chronic problem, it's going to have a cumulative effect on your body. I mean, we all do pass away of something eventually, And a lot of those diseases that we prevent now means that other ones are there that we wouldn't have necessarily gotten at a younger age. So have a good relationship with your healthcare provider, and watch for signs and symptoms. Thank you very much for bringing that to our attention, Manair. So thank you for visiting with us today. And for those of you that are part of the general amateur community, letting us have the clear frequency, we do appreciate that. We do meet every week, and I know this is a common practice on the air frequency. It's very popular. We do appreciate those that are letting us have the frequency. And as you know, Marco, we're a group that promotes goodwill and fellowship among amateur radio operators worldwide, and we may have been professionals in the hearing arts, but also some of us were just have an interest in the various medical dental fields which constitute the hearing arts. So if you'd like more information, healthcarehymns.org. You can download the slides that I used as prompts today for being a moderator of this discussion. You can also look for the Medical Amateur Radio Council website by Googling the Medical Amateur Radio Council. And that's a second website that you'll find as well. Thank you for allowing us the clear frequency. And for all those of you that are participating, I'll give one last call for individuals that would like to get in the check-in log here for today. Make your call to Whiskey Bravo 5 Delta. Okay, with no further comments here, we're going to bring the net to a close. I will hang around for personal conversation for anybody that would like to. I'm going to go ahead here and continue